Understanding imbalances of sodium, potassium, calcium, and magnesium is crucial for nurses, especially when preparing for exams. Here's a brief overview of each electrolyte imbalance, along with key points to remember and potential interventions. 1. Sodium imbalances. Hyponatremia, low sodium. Causes: excessive water intake, diuretics, adrenal insufficiency. Symptoms: headache, nausea, seizures, confusion. Nursing interventions: fluid restriction, hypertonic saline, monitor neurological status. Hypernatremia, high sodium. Causes: dehydration, excessive sodium intake. Symptoms: thirst, restlessness, dry mucous membranes. Nursing interventions: increase water intake, administer hypotonic fluids, monitor for neurological changes. 2. Potassium imbalances. Hypokalemia, low potassium. Causes: diuretics, vomiting, diarrhea. Symptoms: weakness, arrhythmias, muscle cramps. Nursing interventions: potassium replacement, monitor ECG, encourage potassium-rich foods. Hyperkalemia, high potassium. The causes: renal failure, trauma, excessive potassium intake. Symptoms: muscle weakness, dysrhythmias, numbness. Nursing interventions: restrict potassium intake, administer medications, e.g. Kayexalate, monitor ECG. 3. Calcium imbalances. Hypocalcemia, low calcium. Causes: hypoparathyroidism, renal failure. Symptoms: tetany, muscle spasms, seizures. Nursing interventions: calcium replacement, administer vitamin D, seizure precautions. Hypercalcemia, high calcium. Causes: hyperparathyroidism, malignancy. Symptoms: fatigue, constipation, confusion. Nursing interventions: hydration, administer loop diuretics, promote mobility. 4. Magnesium imbalances. Hypomagnesemia, low magnesium. Causes: malnutrition, alcoholism. Symptoms: tremors, tetany, dysrhythmias. Nursing interventions: magnesium replacement, monitor for seizures, encourage magnesium-rich foods. Hypermagnesemia, high magnesium. Causes: renal failure, excessive magnesium intake. Symptoms: hypotension, lethargy, respiratory depression. Nursing interventions: limit magnesium intake, administer diuretics, monitor respiratory status. Key exam tips: know the normal range